Thank you, Harshita. Thank you for your introduction. Um, we will start with today's discussion. Give me a minute, please. So, like Harshita said, we're going to be discussing about how yoga can help women in their day-to-day activities. We have very recently celebrated the International Women's Day, and I wish all of you out there a very happy International Women's Day. So, we all know that we have been, all of us women out there, we have been doing our best in every field possible, be it taking care of the house, balancing the work and the family, doing our best in our professional life, doing our best in our social life, trying to be the best in our personal life as well. So, for women, we all understand, we all know that she's nurturing in nature. She always nurtures the family. She has that nurturing capacity, be it in her workplace, be it in in the group of friends. Wherever she is always nurturing. What most of us tend to forget, because all of us are women here, I'll talk for ourselves. What most of us tend to forget is that we have to nurture ourselves as well. Okay, so if we see these days, you can see women in every profession, in be it IT, be it marketing, be it doing something with be it army, be it navy, be it physical, psychological, intellectual work, whatever that you can think of. Everywhere you can see women, contributing her bit to the society, her bit to the profession and the family. So what is very important is that, uh, as women, we all nurture. You nurture wherever you are. And what we have to also do is nurture our own nature. Our nature of nurturing, our nature of being kind to people, our nature of being strong, our nature of being confident, our nature of being independent. All of these qualities that we have to every time nurture it. We have to keep ourselves bucked up all the time. Okay, and there are many ways for us to nurture, right? There are some of us would want to listen to music, some of us would want our alone time, some of us would want to talk to people, some of us would want to travel, some of us are foodies, so we would want to eat whatever we like. So each of us do it in a different way. But we have to understand, when we say nurture our nature, what are the components of nature that we have to nurture. So the physical nature, the physical body, the physical health of an individual, the muscular strength, the suppleness, the bone health, our stamina, our postures. If we are working day in, day out, family and outside, we have to make sure that we do not end up having musculoskeletal issues, right? So we have to physically nurture our body, which is very, very important. The muscular system mainly, the skeletal system, the circulation, the overall physical posture and poise that we have. The psychological nature. Each of us, we have certain vital functions that happen in our body, right? For women, it is very specific that we have our endocrinal or hormonal functions to work optimally and are in balance. When our hormones go out of balance, then we tend to have lot of issues. That's what we have seen, right? Be it right from puberty until we hit the menopause, we always are at risk of getting into hormonal imbalances, because we are facing a lot of stress, we are facing a lot of ups and downs in the life that we encounter. So physiological nature involves circulation, involves the breathing, involves the optimal function of all the internal organs, and mainly the endocrinal organs, that is the gland or the organ that produces hormones. And these hormones are very, very important for optimal functioning of our system, right? Be it menstrual cycle, be it pregnancy, be it post-pregnancy, be it our bone health, be it our cardiac health. We all understand that until we hit menopause, all women have an extra cardiac protection because of our hormones. But if we let these hormones go out of balance, we are at equal risk of encountering any cardiac issue as well. So physiologically also it is very important that we nurture ourselves. Psychological nature. When we are handling so many things, or when we are some of us are suppressing our wishes, we are not really allowed to do it. Some of us do not have a choice. We even if we are allowed, we are in a state where we are not able to do what we want. Some of us are able to handle everything and do everything that they want. But in every aspect, if you look at it, balancing out on the whole thing, we are going through a lot of stress day in and day out. Some of us end up becoming anxious, ending up with anxiety. Some of us can go on low mood states, ending up with depression. And especially we've understood or we've experienced, a lot of us have experienced that during our menstrual cycles every month, we have mood swings, premenstrual symptoms it is called. We have mood swings during or before periods. Some of us have also experienced mood swings during our pregnancy, post pregnancy. And if we are hitting menopause, if we are attaining menopause, even then mood swings are usually felt. So psychologically, if we can keep ourselves flexible, if we can nurture ourselves so that we can handle any anxiousness, if we can handle any low mood states, that's like wonderful. So physiological nurturing is also very, very important. Cognitive nurture. If we have to be at par with every profession, be at par with every function that we do, cognitively also we have to enhance ourselves. Most of the women, if I don't know how many of you have experienced it, we with so many things that we handle, there are times where we are cognitively a little low. That means our memory power is a little, we do not really remember where we have kept things. Immediately we forget what we had to do. We also tend to go low on processing. We will not be able to focus on certain things, will not be able to process information easily. There are a lot of causes for this, but mostly women tend to go through this and they do not really talk about it. It will be affecting their quality of life, but they don't really talk about their focusing power, their memory power, and all that, because they're really worried about other things than what they are going through themselves. So cognitive nature is also something that we have to nurture and enhance and keep it optimally functioning. And of course, each one of us are spiritual beings, and we have to nurture our spiritual nature where we understand what is the purpose of life that we have on earth. Right? So that definitely when we're talking about yoga, spirituality is something that automatically connects to it, and we cannot leave spirituality just like that. So one of the ways, like we were discussing, there are a lot of ways through which we can nurture ourselves. What we have understood with experience and what we've understood with literature, and of course, lot of backup from the science, is that yoga is one of the best tool to nurture all of these um, layers of our body. When we're talking about physical, physiological, cognitive, psychological, and spiritual well-being, yoga is something that can work on all of these components of an individual. Yoga talks about the Pancha Kosha, right? There's something called Pancha Kosha, which means that our body, or that um, our life has 5 layers in it. One is the physical body, the Annamaya or the physical sheath, the Pranamaya Kosha or the energy body, the Manomaya Kosha, which is all to do with the mental health, mind, our emotions, our thoughts, Vijnanamaya Kosha, which is to do with our intellect, our wisdom, and of course the Anandamaya Kosha, which is the spiritual well-being. So yoga can impact all of these layers And it is scientifically proven with a lot of evidences that yoga can help your physical body, it can help your energy body, it can help your physiology, it can help your psychological health, it can help your cognitive health, and it can help with your spiritual well-being. So when I say as a yoga doctor, when I'm sitting here and saying it, it more or less feels like, okay, she's a yoga doctor, and obviously she'll talk about how yoga is going to be of help to people. I'm not here to convince you about how yoga can be helpful, but I'm here to show you certain proofs, okay, just for you to understand. Because if I talk only from literature perspective, a lot of people do not agree upon. So let's talk science, pure science. So I'm going to give you evidences which are published literatures for every aspect of women health, how yoga is proven to be beneficial. Okay. If you have questions when I'm talking, please put it in the chat box and we will take those questions later. So there was this a trial or a scientific study that happened involving 60 women with abdominal obesity. And when I say abdominal obesity, I think a lot of us become a little active because each one of us, however fat or thin we are looking at weight loss. Women are looking at weight loss every time. And of course, there are few people who want to gain their weight, but majority of us are always happy when somebody tells us that, oh, you've lost weight, right? So let's see whether yoga is really going to be of any help in bringing down obesity in women. So 60 women with abdominal obesity, the intervention was, of course, 12 week of yoga practice. Okay. There were 40 people who were in the yoga group. There were 20 people who were in the wait list group. They were not really not doing anything, but just the measurements were done pre and post. So what all was measured? The waist circumference, weight was measured, body mass index, body fat percentage, muscle mass, all of this physically. And also there was quality of life that was measured with questionnaires. There was a measure of the perceived stress, body awareness, and self-esteem. All of these were also measured in the study. And they concluded, this published literature tells us that they concluded in 12 week of yoga intervention, there were positive, significant positive effects on the anthropometric measurements of the women who practiced yoga compared to those who did not do yoga. Okay, so we cannot just say yoga improved. We have to compare it to somebody who has not done yoga or not practiced yoga. So comparatively, yoga improved the yoga showed positive results in anthropometric measurements. So waist hip ratio reduced, the waist circumference reduced, weight reduced, body mass index came to the normal range, fat percentage improved. All of this were seen with yoga practice. Okay. And now, why abdominal obesity is so important? If somebody has abdominal obesity, that means their tummy growing large day by day, it is seat for low grade inflammation in the body. It is the seat for a lot of hormonal imbalances. They can end up having menstrual irregularities. They can end up having thyroid issues. They can end up having issues with fertility. And of course, post fertility, if they're still obese, they can end up having issues during menopause. It can affect the heart, it can affect the digestive system. So, abdominal obesity, most of the men who go through, women who go through abdominal obesity are at risk of developing certain complications. So, when we can just take care of that with yoga practice, I think we should all start practicing yoga today. Okay, let's not even delay to tomorrow. Let's all start practicing yoga today. Next, let's go to the next problem that most of women face, which is dysmenorrhea or cramps or pain before or during periods in menstrual cycle, right? So this was a systematic review. That means there were a lot of articles published, and from those articles they concluded, they reviewed here, this study reviewed 378 articles that were talking about intervention of yoga for women with dysmenorrhea. Okay, primary dysmenorrhea is something most of the women go through: cramps and pain, clots, irregular menstruation, lot of back pain, tiredness, vomiting. These are the symptoms that come with dysmenorrhea, right? So intervention of yoga was done. It was studied through 378 articles, which is not a small number at all. And they were all the 378 articles told us that there were statistically significant improvements in the pain scores. So the quality of life improved, the physical pain or the cramps that women face decreased, quality of sleep improved, the psychologically also she started feeling better, negative thoughts reduced, and once she's able to be physically comfortable, psychologically comfortable, her social interactions improve, right? So social relationships also improve, work capacity improve. So amongst the people who are participating in the webinar today, if any of us are taking off from our work, from our day-to-day activities during our cycles because of the pain, I think it's high time that we started practicing yoga. Okay, so yoga is very, very helpful in regulating the menstrual cycle overall, uh, regularizing it. If there is a delay in menstrual cycle, we can, regularize it. If there is excessive bleeding, we can bring it down. If there's very less bleeding, we can enhance the quantity of bleeding. And if there are a lot of clots that are going out, that can be taken care with yoga practice. And mostly the pain and discomfort that women go through during their cycles, that can be taken care with yoga, regular yoga practice. Next, Journal of American Osteopathic Association published this article on PCOS. We've had another webinar on polycystic ovarian syndrome as well, right? So majority, if we see the statistics, every 3 in 10 women these days are diagnosed with polycystic ovarian syndrome and are having a lot of irregularities in their cycles, weight gain, hair growth, acidity, constipation. All of these issues are being faced by women with PCOD. And most of the women have difficulty with fertility when they have cysts in their ovaries. What is happening when somebody has PCOD is that their androgen levels, that means male hormone levels in the female body, is high. Okay, so what basically the study was about 31 women with PCOD. They were in between the age of 23 to 42. Okay, pre-pregnancy. So people who have not really have had pregnancy. So even for fertility, there were people after fertility as well, to see whether yoga can help with managing PCOD. Okay, it was a randomized control trial, and hormonal levels were measured. Along with hormonal levels, we also measured glucose levels and insulin levels. Most of us know that PCOD has insulin resistance, which is one of the things that happens with PCOD. So insulin resistance was observed, insulin levels were observed, and hormonal levels were tested. And of course, the mental health, anxiety and depression scores were also measured during the study. And again, this concluded that the improvements observed suggest that regular mindful yoga practice can be useful in bringing down the cysts in the body, bringing down the male hormone levels in the body, improving female hormone balance, and of course help in maintaining the mental health of the women. Okay, and for PCOS, the hallmark is that male hormone level goes up. Okay, androgen levels and the testosterone and androsterone, these levels go up. So we have to make sure that without really inducing any female hormonal imbalance, can we bring down the male hormone levels in the body. So yoga helped with bringing down that as well. And you see there's an asana here, Baddha Konasana. I've specifically put this asana here because Baddha Konasana, or the butterfly posture, is very, very effective in, if somebody has PCOD, if somebody has menstrual irregularities, this is the asana that we have to all practice. Okay, I will show you, if you guys are ready, we can do a very small practice of Baddha Konasana also. I'll play a video. I will give you instructions. Please make yourselves comfortable to practice Baddha Konasana. If you have very recently had your breakfast, do not practice it. Just look at the demonstration. But if 2-3 hours post meal, and if you're comfortable, let's practice Baddha Konasana. Yes, give me a minute, please. Okay. So, am I audible?
Yes, doctor, you're
Yeah. So this is the posture. Let me go back again. If all of you are ready, we will start now. All of you first sit comfortably in this posture where we all sit. This is called the Sukhasana. Comfortably sit in this posture. Keep your back erect. Try to first regularize your breathing. Try and
doctor.
slow down. Yes.
I'm so
Yes.
sorry to disturb. Doctor, the video is not playing.
Yeah. I've paused it. I'm just giving the basic instructions before I play the video.
Okay, fine, doctor.
Okay. So if all of you are ready, now we will start. I'm going to play the video now. So from this posture, slowly, join both your feet together and place your feet as close as possible to your pelvis. Okay. Try to keep your legs as close as possible to your pelvis. Try to straighten your back. Relax your knees down. Relax your knees down and breathe out as you bend forward. Try to keep your back erect. Okay. And you can either touch your chin or forehead to the floor in front of you. Okay. The point is that you have to keep your back erect and relax your legs down so that you can open your hip joint comfortably and enhance the circulation to the hip joint. Okay. Slowly breathe in and come up and relax your legs. Okay. This is Baddha Konasana. Okay. Was there any doubts? Was there any confusion? Baddha, sorry. Yeah, Harshita, please tell.
Doctor, can you play the video only once again because the video was not saved.
Okay. I will do that. I'll do that. Is the video visible, Harshita? Harshita?
No, doctor, can you play the video once?
Yeah, I am playing it. Is it not
We can
visible?
only see the folder, desktop folder.
Oh, okay. Can you all please give me a minute? I'll just check why you're not able to share that. Huh.
Sure, doctor.
Is it visible now?
Yes, doctor.
Okay, so I will play the video. I'm sorry, I was not aware that the video was not being played. Let's practice again. All of you sit comfortably in Sukhasana. Try to keep your back erect. Try and slow down your breathing. Yes, all of you are comfortable. Now let's start. Once you're in this posture, slowly relax your leg and place both your feet facing each other. Join the feet and the feet facing each other. Try to keep your legs as close as possible to your pelvis. Keep your back erect and relax your legs down. Relax your knees down. Slowly, as you breathe out, bend forward. Try to touch your forehead or your chin to the floor in front of you or to your feet, wherever possible. But try not to hunch your back. Keep your back erect. Slowly breathe in and come up. Observe your hip joint, observe your pelvic muscles, observe your thigh muscles. There was a beautiful stretch when you practice Baddha Konasana. This posture is very, very helpful in opening your hip joint. Okay, it helps open up your hip joint, enhance the circulation to your pelvic organs, be it your uterus, be it your fallopian tubes, be it your ovaries. It will help enhance circulation to the pelvic organs. So, especially Baddha Konasana, this asana is very much an indication to every age group of women, be it during puberty, during the time when they start their menstrual cycle until menopause. This is like one of the mandatory poses for all the women out there to enhance pelvic functions. Okay, Baddha Konasana, even during pregnancy until 5 months of pregnancy, Baddha Konasana can be comfortably practiced. After fifth month, we can practice Baddha Konasana without bending forward. We can just keep our legs, feet facing each other, help hip to open up, help the labor process as well. So Baddha Konasana is one such posture. Okay. This I can guarantee women who are going through menstrual irregularities, start practicing Baddha Konasana and you will see significant changes. Okay, I am sure of that. So let's move on to the next slide. Again, polycystic ovarian disease, they also have impaired glucose metabolism in the body and increased lipid levels. That's why we see that women with PCOD tend to gain weight, tend to have craving, tend to have a lot of hair fall, tend to have digestive issues when they have PCOD. So metabolic activity will also be deranged. So this study was about the effect of yoga program on glucose metabolism and blood lipid levels. So what they basically practiced in this study was Surya Namaskara, certain pranayamas and meditation for 1 hour every day for 12 weeks. So before starting the session, before starting the intervention, there were studies or there were measurements for glucose metabolism and blood lipid levels. And after 12 weeks of yoga practice, the same thing was done again. Okay. And it was compared to a group who did conventional physical exercises like be it walking, jogging, playing shuttle and all that. Conventional physical exercises, one group, the other group practiced yoga, and yoga group showed effective results in glucose metabolism and bringing down the blood lipid levels, triglycerides, cholesterol levels, improvement in high density cholesterol. This was seen. And also insulin resistance decreased in group that practiced yoga. Okay, insulin levels came down and also insulin resistance of the cells also decreased with yoga practice. That means metabolic activity will be enhanced with practice of yoga. Okay, and when once especially glucose metabolism is taken care of, PCOD will become easy to manage. So practice of Surya Namaskara, the 12 steps sun salutation, is very, very helpful in weight loss, in improving the metabolic activity, in taking care of a lot of musculoskeletal issues as well. Just practice of 6 to 12 rounds of Surya Namaskara every day is going to be very helpful. Now, pregnancy. Coming to the stage of pregnancy where women go through 9 months of pregnancy, and the process itself is very, very complicated at times, of course filled with a lot of joy, but she will know what she goes through. Pain, back pain, there's going to be mood swings, there's going to be GERD like symptoms, there's going to be a lot of stress, there's going to be pelvic pain. A lot of these things can happen for a pregnant woman. It's not that these are mandatory, but for some women, there's these issues that she will go through. So 8 randomized control trials, that means 8 separate research studies were reviewed in this article, and there were certain asanas as intervention in yoga, there were certain breathing exercises and meditation that improved the quality of life of a pregnant woman. What basically yoga did was it reduced the pelvic pain, because the baby is growing inside and the structures stretch. A woman can experience pelvic pain. So pelvic pain reduced with prenatal yoga practice, and also enhanced their psychological function. So stress levels reduced, depression scores came down, anxiety scores came down. And along with psychological health and pelvic pain, physical condition, as in during delivery, the time taken for delivery and the pain component of the delivery also showed significant improvement with the practice of prenatal yoga. Okay, so there was improved quality of life during pregnancy, and it eased the labor. Perinatal outcomes also improved with the practice of yoga. The delivery time came down, the complications were less for the group that practiced yoga. Okay. Now, the effect of yoga on delivery and neonatal outcomes. Okay, so pregnancy of 9 months, 70 pregnant women were included for the study from 26th to 37th week. That means the end of second trimester to the third trimester beginning, they practiced yoga. Okay, they exercised, they practiced yoga twice a week and practiced it for 1.5 hours. Okay, around 1 hour, 15 minutes to 1.5 hours of yoga practice. And all of this, the women otherwise in the control group, they were just given the prenatal support and care, but they did not practice yoga. And all of these 70 pregnant women, they showed that or yoga helped them with reduction of the induction of labor. So the labor was spontaneous and natural. Induction was not necessary. Episiotomy rupture was not happening with women who practiced yoga. Duration of labor reduced with yoga. And of course, there was also effect on the baby. The normal birth weight of the baby was good in women who practiced yoga, and their babies had good normal birth weight. And also there's something called Apgar score that measures the health of a newborn baby, and that was very optimal and good for women who practiced yoga in their pregnancy. Okay? So we have understood how yoga has helped in most of the normally going through normal pregnancy and going through normal labor. But there are some women who have to go through assisted reproduction techniques like IUI or IVF. Is there any role of yoga for women who go through IVF or IUI? Yes, there was. Yoga was the intervention, and there were 87 studies that were reviewed in this paper. And the review showed that the yoga can provide better stress management techniques for patients who are going through IVF. See, going through IVF itself is a stressful process in itself. So practice of yoga can take care of improving the psychological status of a woman. So her anxiety levels will come down. She'll not go into low mood states, and which are all very important for outcome of IVF. If IVF has to be successful, psychological health is also very, very important. Along with that, it helped in the physical aspects as well. Like we discussed before, it helped in bringing down the pain, bringing down the complications, and helped in vaginal delivery, and also improved the fetal outcomes. So yoga definitely is helpful even in during assisted reproductive techniques like IUI or IVF. Okay. Now, for women who delivered a baby and are going through postpartum depression, most of the women, or some women at least, go through postpartum mood swings, low mood states, and can, sometimes complicate into a postpartum depression. And yoga was administered, or the intervention was yoga practice for 57 postpartum women with depression. So they were diagnosed with postpartum depression, and they were taken into the study to see whether yoga helped them. Yoga was for 16 sessions over 8 weeks. Okay. And the outcome measured was depression scales, anxiety scales, and quality of life scales. And yoga showed significant improvement in all of these scales. So postpartum depression, which is a nightmare for people, for women who have experienced postpartum depression, they'd want something that will help them come out of it. So yoga is a great tool that will not make a new mother who's given her cells for the birth of the baby, it will not drain her. It will only enhance her energy. So yoga is not going to be like a physical exercise which is going to make her tired. It is going to re-energize her physically and also help improve her quality of sleep, improve her psychological states. Okay, this is what yoga can do postpartum, post delivery, for women who are going through mood swings or depression or physical issues as well. Now let's go into menopause, which is like the last stage where women find issues in managing herself, because menstrual cycle is something that is very supportive of her nature. When she is going through menopause, a lot of hormonal changes that happen within the body, and when that hormonal support goes down, she can go through a lot of mood swings, sleep issues, hot flushes, body pain, lack of energy, and there are a lot of somatic symptoms, that is physical symptoms, lot of circulation changes. Some women can also go through issues with their urination, control of the urination. So urogenital issues can also be there for some women. So 1,306 participants with in various studies were reviewed, were observed to see whether yoga helped go through their menopause comfortably. Did yoga ease their menopause transition? And yoga seemed to be very effective and safe during menopause, to reduce the menopausal symptoms. The physical symptoms and the psychological symptoms of menopause can be taken care with yoga. Okay, so apart from her milestones from puberty to menopause, she every day, day in and day out, she can go through a lot of psychological stress, right? Anxiety. Some women go through depression. Some women go through a lot of mood swings. So specifically, yoga studied the psychological outcomes in the study. 52 women around 40 years of age with depression were studied, and intervention with hatha yoga exercises for 4 weeks. And the results showed that their depression scores reduced, anxiety scores reduced, and stress levels, perceived stress levels, also significantly reduced in the practice of yoga. 12 sessions, 4 weeks, 12 sessions of yoga help them enhance their psychological well-being as well. So when we understand the physical nature, psychological nature, physiological nature. We did those, right? So yoga is proven with experience. Literature talks about it, and also it is backed up by scientific evidence. These papers are not just taken from some websites. These are very authentic papers that are published in very important high rated journals of the world. So these studies give us proof that yoga is safe, yoga is effective for women in helping her nurture herself. A practice of 1 hour of yoga every day, she'll be able to manage everything else so beautifully. That's what I've seen with my personal experience also. Like when Harshita was saying, I had keen interest in yoga since my childhood. Now that I've gotten into this profession of being a doctor in yoga, I understand how yoga is helping all of us in taking care of our day-to-day activities with ease and comfort. Practice 1 hour of yoga every day in the morning, and you will start seeing difference. You will start seeing changes yourselves. We can make that. Let's just experiment. Let's start practicing yoga. Let's practice continuously for 1 month and see whether it brings any change in our day-to-day activities, our stress handling ways, our physical health, our psychological health, and our physiological health. We will see if it creates a difference or not. If it does not create any difference, I'm very sure that it does. If that does not create any difference, then I would really not, convince you or give you any more proof to practice yoga. Okay, so we have talked about so much about yoga. Let me just take 2 minutes. How should yoga be practiced? Should it be practiced just like an exercise where we do some physical postures and okay, we are done with yoga? No. Yoga is an inward journey. Okay. So when you're practicing yoga, you should tend to relax. You should tend to practice with awareness, enhance your awareness during the practice. Okay, even be it a physical posture, be it a pranayama, be it a relaxation, you will have to practice yoga with a lot of awareness of the body, of the breathing, of the mind. Only then you'll be able to attain that state of balance in all of these levels, be it physical, psychological, physiological, cognitive, spiritual being. All of it can come into a state of balance when you practice yoga with awareness and not just practicing yoga with some other thoughts running in the mind. What breakfast should I cook? Or how should I plan my professional, plan my day at work? There's so many meetings, there's so many designs that I have to make, there's so many patients that I have to see. If I'm practicing yoga with all of these thoughts running in the mind, it'll really not give us the result. We have to practice yoga with involvement and with awareness of what is happening with our body, with our mind, and with our breath. So that's the apt way of practicing yoga. And if you want any help in learning how to practice yoga, in understanding the effects of yoga, if you want sessions, please feel free to contact us, and we'll be able to help you on that. So to summarize, in the end, yoga can help women during puberty, taking care of her menstrual health, pre-pregnancy to help her enhance her fertility, during pregnancy to make her 9 months of pregnancy comfortable, post and also the delivery process to make the delivery process easy, postpartum to enhance the physical energy and psychological health, and can help women during menopause at the physical level, at the physiological level, and at the psychological level. So with this, I conclude the webinar for today. If you have questions, please feel free to ask your questions. And for those who are looking out for, um, help with yoga practice, like I said, please visit our website, www.anandamayawellness.com, or you can, reach us through Facebook or Instagram. You can call us, you can visit us at the clinic. Please feel free to contact us if you are looking out for help with yoga sessions. Any questions?
I think, doctor, we can wait for 5 minutes for any more questions.
Sure, we'll do that. We'll wait for Veena, can you please post your question in the chat box so that we can address your question? During pre-menopause stage, apart from yoga mentioned here, what other yogasana will help? Okay. So pre-menopause, a lot of women go through. Currently, I am in that stage, irregular periods and a lot of stress with thoughts. Okay. So what we have to make sure is when you're practicing yoga, especially menopause, it's about physical health because she's going through a major physical transition that her menstrual cycle is stopping, and also certain psychological changes. Like you said, you are having a lot of stress that you're going through, right? Menopause itself will make your stress handling capacity a little lower. So when you start practicing yoga along with uh, what I showed in the picture, you will have to do postures, that are holistic, not just one posture, not just one Surya Namaskara will help. So there are certain asanas that will help, like practice of Baddha Konasana, practice of Virabhadrasana. There are so many asanas. If I name, I think I'll probably confuse you. You can, when you visit the clinic, please feel free to, sit and discuss with us the postures that will help you. Along with asanas, you will have to definitely go through pranayama, which are breathing techniques. You should also go through relaxation techniques because that will help take care of hot flushes. It will help relax the mind. It will help enhance the quality of sleep, and also customized or tailor-made meditation techniques for you. Okay, so these techniques, along with the posture that I showed you, will help to ease your menopause, ease your journey, journey of menopause. The perimenopausal phase, like you said, is difficult if you have a lot of stress and clots going out, irregular periods and all that. You should definitely start practice of yoga soon. If you are doing, please feel free to come to us and discuss. We will be able to modify the practices for you and you. I hope I've answered your question. Any more questions? Thank you. Thank you. Any more questions? I think there are no questions. If you have any questions, like if you get more questions later on, like I said, please feel free to contact us at any point of time.
Okay, doctor. I think we can end our webinar with this. Thank you so much, doctor, and thank you so much, everyone, to join our webinar today. You can also follow us on our social media channels on Facebook as well as Instagram, named Anandamaya Wellness Center. You can also visit our YouTube channel to see more yoga videos and know more about naturopathy and how to increase your quality of life. if and many such small tips on our YouTube channel. Again, the name for the same is Anandamaya Wellness Center. Do subscribe and follow us. In case of any doubts, please visit our website. You can also give us a call for booking an appointment or any online consultation. Thank you so much, everyone. Thank you, doctor.
Thank you. Thank you, Harshita. Thank you, everyone, for your patience through the webinar. Thank you.